Hi everyone, and welcome to the Women's Hormone Health online event. We are celebrating the Seed Cycle's first birthday. For those of you who don't know, my name is Mel. I am the founder of the Seed Cycle, and we are on a big mission to help women balance their hormones naturally. Today with me, I have Tris. Welcome, Tris.
Hello, thank you so much for having me.
Thanks for joining us. Now, for those of you who don't know, Tris is a holistic clinical nutritionist specialising in women's health, PCOS and fertility. She uses a holistic and evidence-based approach with nutrition, lifestyle, supplementation and functional testing to support women wanting to nourish their bodies and balance hormones, reverse PCOS symptoms and optimise their fertility, so they can have vibrant energy, symptom-free cycles, glowing skin, and feel empowered and confident on their health and fertility journeys. Tris's mission includes empowering women to reconnect to their body and improve their relationship with food. Thanks again. It's so great to have the opportunity to speak with you. Before we get into it, I just want to repeat a few of those outcomes you had listed in your bio. So you said vibrant energy, symptom-free cycles, glowing skin, feeling empowered and confident. When I read that, I just thought, wow, doesn't every woman deserve those things?
Absolutely. And I feel like that empowerment and confidence is such a big thing. I feel like, we're not really, as women, we're not really, taught very well about how our body works. And, it kind of makes us feel a little bit disconnected from everything that's going on, particularly when you start to see things like symptoms pop up around, hormones, and just bringing us back to how our body works and being a little bit more in tune with everything that's going on can just make all the difference.
Yeah. And reading that out, I felt so much hope in that, because there is hope. And I think as women, a lot of the times you get to a point where you feel really hopeless, and like nothing's going to work, or, I'll never get rid of these symptoms. And it's just not true. So, having that hope, and then connecting with amazing people like yourself who have the knowledge to be able to educate you. And I love it so much.
Amazing.
So today you'll be sharing with us 5 steps to reverse your PCOS symptoms. I know that our listeners are going to find this information so valuable. We get quite a lot of customers telling us that they're struggling with PCOS symptoms. Over to you. Tell us all about it.
So much to talk about. Well, I guess I wanted to start out with a really quick overview of what PCOS is. So whether you are someone who has been diagnosed with PCOS and you're a little bit unsure about what that means, I know that was definitely me when I was first diagnosed, or whether you suspect that you have PCOS or something is going on and you're really unsure about like what the next steps are to take. So as a quick overview, PCOS it's known as a hormonal imbalance condition, but it's really a whole body condition. It impacts everything from the reproductive system, so the ovaries, to metabolic health. So things like insulin resistance can pop up. It can impact the thyroid, the adrenals, the nervous system, the gut. So we do see some quite widespread symptoms, and every woman with PCOS can experience those symptoms slightly differently. To be diagnosed, the doctors will use something called the Rotterdam criteria, and you need to have 2 out of 3 of these diagnostic criteria. So number 1 is irregular menstrual cycles, or quite often we see menstrual cycles or periods that have gone completely absent. So you might not have had a period for quite some time. High androgens, which is a blood test that measures testosterone, free androgen index, or DHEAS, and they're male predominant hormones. Women still do need them, but we just have them in very small amounts. But when we see them in high amounts, that's what causes a lot of the symptoms of PCOS. And then there is, of course, the polycystic ovaries seen on an ultrasound. So you don't have to have all 3 of those. You do need to have at least 2 out of the 3. To clear up a little bit of the confusion that happens a lot, you can have, or a woman can have, polycystic ovaries without actually having polycystic ovarian syndrome. So they're two different things. Polycystic ovaries sometimes are seen on ultrasound, but unless you've got those other, had those other blood tests, then it can't really be confirmed. So that's, I guess, yeah, just a really quick overview. Now, as I said, like it is really a whole body condition. So when we look at, treatment strategies for it, we're looking at the body really holistically, because we know everything like works together. It's not just about the ovaries or the hormones. Something I wanted to point out was because women with PCOS have, or quite often have, irregular menstrual cycles, or they're not ovulating when they do have a cycle, it can impact fertility. And quite often what happens is that a lot of women are told, because you have PCOS, you can't fall pregnant and you'll need to have IVF. And yes, it's wonderful we have IVF and these other fertility treatments, but I want women to know that it's not your only option with PCOS, because a diagnosis of PCOS isn't a diagnosis of infertility. And I know everyone's fertility journey is really different. We don't always know what that's going to look like for anyone. But with PCOS, it is actually possible to fall pregnant naturally. What's happening is, because you've got this irregular menstrual cycle, because you're not ovulating regularly, if you're not ovulating, you can't fall pregnant. And so what we want to do and work out is why you're not ovulating, to help you ovulate and get that regular menstrual cycle back, and to support your body to produce progesterone and the hormones around the menstrual cycle to increase your chances of falling pregnant. So I just always like to give women that hope and that understanding that it is actually possible to fall pregnant naturally, and fertility treatments aren't your only option. So that's, I guess, the overview. Symptom wise, a lot of women with PCOS will experience slightly different symptoms because the underlying causes differ. So we tend to see, as I said, the irregular menstrual cycles. We see, I see a lot of acne and skin breakouts, and that's because of the higher levels of androgens, those male hormones. We see something called hirsutism, which is excessive hair growth. So you might start to see darkening hair growing on the chin, the upper lip, sometimes on the abdomen. You might even see like darkening of arm hair and things like that. We also see thinning hair, so on the scalp, actual like quite thinning hair. Fatigue is really common in PCOS. Weight gain or difficulty losing weight can be common in PCOS, not for everyone, but it can occur because of those high androgens, and also sometimes because of insulin resistance. And anxiety and depression are really common with PCOS. So obviously it's not caused by your PCOS, but it does occur in higher rates in women with PCOS. So they're all sort of, I guess, symptoms and things that I like to consider, like I said, like, considering a woman really holistically when it comes to PCOS treatment. There is, we don't really know the cause of PCOS, but there's a really strong genetic component. So some of the studies and the theories around it is that it's part genetics and then environmental exposures. So everything from like early life and in utero exposures that may predispose women to having PCOS later in life. But really, it's what we really want to delve into is not just the symptoms, but the underlying cause of those symptoms. And that's a really, really, I guess, key point that I want to make, because those underlying causes can be slightly different. So in some women, we see insulin resistance. It happens in about 70 to 80% of women with PCOS.
Pretty high.
A lot. Yeah, definitely a lot. Not every PCOS woman, but there's, definitely a lot. Inflammation is probably one of the biggest ones. Just that underlying low level chronic inflammation is seen in just about every woman with PCOS. And that's like another area to work on. Stress, like physical, mental, emotional, all sorts of stresses that the body is under can impact hormones and impact PCOS symptoms. Gut dysbiosis, I quite often see, especially when there's a lot of skin breakouts and acne, there's usually stuff going on in the gut, environmental toxin exposure, and thyroid dysfunction. So they're some of the key underlying causes that we see with PCOS. And when we look at managing and treating those underlying causes, that's when we start to see the hormones come back into balance and those symptoms ease and reverse. So you can't cure PCOS because, as I said, there is a genetic component, but you can absolutely reverse those symptoms of PCOS, which is really promising. So I guess it brings me to like nutrition and lifestyle and what that kind of treatment can look like. So nutrition and lifestyle is the first line treatment for PCOS, and we use strategies, nutrition and lifestyle strategies, to get to those underlying causes that I spoke about. And that's why when managing PCOS, it's not about just one thing. You know, we quite often, there's a lot of information out there, and women quite often come to me feeling really confused and overwhelmed and stressed about all the information. Or they'll see things like everybody with PCOS needs to just go gluten and dairy free, or everybody needs to just cut their carbs out. Yeah. So they see these kind of,
no carb, low carb.
Yeah.
Around that too.
Absolutely. So we see a lot of this information, but it's not about just one thing. It's not about, you know, cutting foods out or cutting carbs or just taking a supplement because you've seen it being marketed for PCOS. It's coming back to that holistic treatment, and looking at each woman as an individual, what's going on for them, and treating that. There's really no one best diet for PCOS, but there's definitely some strategies that we use, and I'll talk about those. But nutritional treatment really needs to be individualized. It needs to be holistic. It needs to be sustainable, because if you're not able to continue doing it, then it's not going to last, and it's not going to be very helpful. And it also needs to be adaptable to your changing needs and symptoms and goals. And what I mean by that those changing needs is that you might find that I'm treating a woman with PCOS and we're doing a lot of gut work. And then once the gut's sort of healed and everything's looking really good there, we no longer need to do all of that work on the gut. So just being a little bit adaptable and changeable. So what I really wanted to talk about, I guess, was 5 steps to reverse your PCOS symptoms. So there's sort of 5 big areas that I work on with PCOS women to help them reverse their symptoms. 5 sort of areas of the body that we work on. And, you know, even if you've got different underlying causes, we're addressing all of those kind of areas to get that really beautiful holistic treatment. So number 1 is addressing your underlying causes. So like I've mentioned, you know, we can use blood tests, we can use, you know, doing like a thorough health history and case history, finding out what symptoms are, to really discover what those underlying causes are. And we can focus on those areas to bring down levels of androgens and insulin, if there's insulin going on. And once those levels of androgens are coming down, that's when we start to see reversal of symptoms. Now, some of those blood tests that we look at can be done, a lot of them can be done through a GP. So it's just about talking to your GP about you really wanting to take a proactive approach with your PCOS. There is also the option of working with like a functional practitioner that can order additional tests if you're really struggling. But I like to do a lot of them through GPs, because then it's also, you know, a lot of it's covered by Medicare where possible. So yeah, number 1, addressing your underlying causes. Number 2 is balancing blood sugar levels. And this is a really key step to balancing hormones, because our blood sugar levels really control everything from appetite control, so hunger and satiety, to cortisol, our stress hormone. It can have an impact on that. It can have an impact on insulin. So all of those things have such a huge impact on hormonal balance. So number 1, I guess, for balancing blood sugar levels is ensuring that we're eating adequate protein throughout the day, and having protein spread evenly throughout the day. So with each main meal, breakfast, lunch, and dinner, whatever that looks like for you, ensuring that each of those meals contains, you know, a minimum 25 grams of protein. Potentially, if you're having snacks as well, potentially a little bit of protein in your snacks. And we're wanting to reach, you know, at least 100 grams of protein a day, which is a lot higher than what is, you know, say suggested in the Australian dietary guidelines. But it's the amount that women really need to support hormonal production, to support their hunger hormones, to support blood sugar balance and insulin.
Yeah.
So
That's
yeah.
a really good point. And I find like protein, even for myself, it's often the first to go. Like if I'm busy or if I just, having like a day where I'm like a bit like, oh, I couldn't be bothered.
Yeah.
It's often the one that kind of gets missed in those meals. So understanding the importance of it and the role in blood sugar and then that flow-on effect. It's a bit more incentive to go, no, come on, add that egg with the avocado on toast.
Yeah.
Yeah.
Absolutely. And, to be honest, I don't think I've yet had a client who was eating too much protein. It's usually the other way. It's usually not quite enough. And I think that's also because, as a society, we tend to have low protein breakfast for a start. So we're then trying to catch up for the rest of the day. So if I can give one, really big tip, it's look at your breakfast and ensure that first meal of the day, you're having adequate levels of protein in that first meal. So whether that looks like some scrambled eggs or yes, adding that egg on avocado toast, whether it's, a beautiful smoothie or smoothie bowl that contains some protein in there is really, really important. The other really big step for blood sugar balance is adequate fiber as well. So having enough like non-starchy veggies during your day. Fiber slows down digestion so that we're not getting the blood sugar spikes and drops, so to help control that blood sugar balance throughout the day. So just think about each of your main meals having, a couple of cups of veggies. Might be like a beautiful cup of leafy greens to start like your lunch bowl, and then adding in like another cup of some roasted veg, and then adding your protein and your carbs and your fat sources on top of that. But yeah, definitely getting in lots of fiber. Even some simple swaps, like if you're swapping like a white rice for like a whole grain basmati or a brown rice, you're increasing the fiber. If you include some legumes during your day or your week, that's, they're quite high in fiber. You can add some more fiber into your diet that way. So there's lots of little strategies that you can add more fiber into your meals to balance your blood sugar levels. I actually, when we talk about balancing blood sugar levels, I make this step really, really simple, like without having to count calories or, track your foods or do any of that. But I teach my clients to start with what I call like a PCOS friendly plate. And so I sort of imagine like your lunch or your dinner plate and portioning that up. So you start with half a plate of non-starchy veggies. So that's all your fiber and your nutrients and your antioxidants. Then adding a quarter of a plate or a palm size of quality protein. So that could be like, some grilled chicken or salmon or some eggs. Then adding about a quarter of a plate of starchy carbohydrates. So that might be, your brown rice or, a really quality seeded sourdough bread or some roasted potatoes. So a little bit of carbs, and that carb amount might be slightly different for everyone depending on your level of insulin resistance and how well your body tolerates carbs, and also even how active you are. Like if you're quite an active woman and you're going to the gym quite often or you're exercising quite often, you might need slightly more carbs than someone else.
And where you are at in your cycle as well, like I find like that luteal phase, it's like that's when I can really feel like I need the carbs, but then kind of pass that into follicular, a little bit less kind of works better for me, and more protein, and
Yeah, definitely. Actually, on that as well, in that luteal phase, like our bodies use more calories during that phase, and that's when we tend to get those cravings for carbs and sugars. And that's normal. That's our body searching for more food. So don't feel like, I say to women all the time, don't feel like you can't eat that little bit extra because you're hungry, your body's needing it. Carbohydrates. And then the last step is the healthy fats as well. So that might be like your beautiful nuts and seeds or avocado. You want to add at least, 2 tablespoons there. And fats also slow down digestion and slow that release of insulin, so we can bring insulin levels down as well. But that very, very simple step of that PCOS friendly plate is going to make the world of difference to your energy, to your symptoms, to your skin, to your menstrual cycle. It's like a really big step.
And I love that it's just something that you can have in your head. Like you don't have to go and yeah, like you're saying, count calories or go look something up. It's just like, it's such a simple formula that you can memorize really quickly, and then it becomes a habit of like, this is just how I create each meal.
Exactly. And it means, you know, you don't have to follow a meal plan. You don't have to, you know, have set recipes. You can apply it to any sort of food, any foods that you enjoy.
Yeah.
Which kind of brings me to the next step as well. So number 3 is reducing inflammation and nourishing the hormones. And this is where we get a little bit more specific into the types of foods that we want to eat in abundance that can help to reduce inflammation. So there's beautiful anti-inflammatory foods like oily fish, nuts and seeds, berries, broccoli, even using turmeric, like the spice, adding that into like curries and stews, extra virgin olive oil. So that helps to bring down those levels of inflammation that we really see in PCOS. And then other foods that are really good for nourishing the hormones. So, you know, omega-3 rich foods, so those oily fish again, magnesium rich foods, zinc. Zinc is a really big one. So, and I quite often, it can be a little bit difficult to get zinc in the diet. So again, nuts and seeds, and seafood are some big ones. Oysters, if you do like oysters. But zinc is an anti-androgen, so it actually stops the conversion of estrogen to testosterone. So zinc is a really big nutrient for women with PCOS, and supplementation can be really beneficial for a period of time there too. So it's like specific foods that help to nourish your hormones. Number 4 is optimizing gut and liver health. Now, we know that the gut plays a huge role in hormonal balance. We even have within the microbiome, so those bacteria in our gut, we also have what's called the estrobolome. So it's specific bacteria that actually balance estrogen levels within the body. So the gut plays a huge role, and it also plays a role in bringing down inflammation and supporting that, immune function as well. Often when we see the gut and the liver struggling, we not only see hormonal imbalances, but also start to see things like the skin breakouts, the fatigue. So supporting the gut and liver can be done through certain foods. I also say as well, we should all really be having at least a daily bowel movement that isn't loose or isn't too hard to pass. And if you're not having a daily bowel movement, you're not moving like excess estrogen and cholesterol and toxins out of the body. And so we definitely need to do some work on the gut there. But to start off with, supporting that gut is like removing any known food intolerances that can cause inflammation and irritation in the gut, and then supporting it with some prebiotic and probiotic foods. So prebiotic foods feed beneficial gut bacteria, and they then produce short chain fatty acids, which feed the gut cells and reduce inflammation in the gut and ensure everything's working really well. And then again, those anti-inflammatory foods and even nutrients like glutamine and collagen can help to heal and strengthen that gut lining so that you're actually absorbing nutrients really well. And then we've also got bitter foods. So bitter foods are things like apple cider vinegar, lemon, rocket, and cruciferous veggies. So like your broccoli, cauliflower, cabbage, they all support liver detoxification. So that ensures that our liver is doing a really good job at metabolizing and detoxifying our hormones to bring them back into balance.
I love that you brought up the liver, because the last video I spoke to Sally, who's a dermal clinician, a holistic dermal clinician, and she spoke about skin and hormone connection. And one of her big things was liver and supporting the liver to be able to detox. Yeah, so it's, it seems like every one of these events that we do, it's all intertwined.
Yeah. Oh, that's amazing. I would, definitely love to listen to that one, because the liver definitely plays a huge role in that hormonal balance. So, definitely if you haven't, go back and watch that one as well. That'll give you more in-depth into supporting the liver for PCOS.
Yeah,
for sure. And then the last step is creating a supportive lifestyle. So it's not just about the food we eat, but it's also things like our stress management, movement, women, and this is just generalizing, but a lot of women tend to carry a very feminine energy. So we all have like masculine and feminine energies within us. But the feminine energy really thrives on movement. So our body really like just enjoy it, whether it's a daily walk or, it doesn't have to always be structured exercise, but that's also great. But even, a daily walk, Pilates, yoga, or any of those kind of things that help to move our body is really important. Movement also helps to lower stress. And like I said, stress management. Stress is huge when it comes to hormonal balance, and particularly for women with PCOS. When stress is high, that's when we start to get the blood sugar imbalances, the high levels of insulin. It can cause more inflammation. It can cause that higher level of androgen production, and that's when we see the symptoms of PCOS. So stress management, and whatever that may look for you, whether it's working with a counselor or psychologist, whether it's meditation or journaling or movement, whatever it is to help you manage that stress. I also use nutrients too. So like magnesium, for example, is a very supportive nutrient for the nervous system and for stress response. So that's definitely, it can definitely be done through nutrition as well. But overall stress management is really important. And then even sleep optimization. So setting up an environment for quality sleep, because when we don't sleep, when we don't have quality sleep, it impacts insulin and blood sugar imbalance and that appetite control. And that's where we start to see the really strong cravings and sugar cravings when we're not sleeping very well. So some just really even quickly as a way to optimize sleep is getting some morning sunlight. So getting outside and getting sunlight exposure without sunglasses on, and actually like outside, not through a window, but getting that morning sunlight exposure helps to tell our brain to produce melatonin to secrete later on at night. And then as you get into the evening, you can just do the simple thing of turning down lights. So instead of having bright lights on, just keep on some lamps and have like a nice darkened room to signal to your body that it's nighttime, and it'll start to release that melatonin for really restorative sleep. Melatonin is also a really strong antioxidant. It can be really beneficial for PCOS women to bring down inflammation and to regulate that menstrual cycle.
I love that tip about turning down the lights. We started doing that when we had the kids, and now I notice that if my husband turns on the lights and it's like in the evening, I'm really irritated. Like my eyes can't handle that light anymore, and I'm always going around turning down the lights. And even in the morning, I find like if all the lights are on in the house, it's just a little bit much. Yeah, so it's interesting how once you get into that habit, you notice the effect it's having.
Absolutely. Like light and dark is such a big signal to the body, to this our like circadian rhythm balance. It signals all those hormones and those hormonal changes. So sometimes those little simple things that we do, we don't realize has such a big impact on our hormones.
Yeah.
So yeah, just as a little recap, so those 5 sort of areas and those steps is addressing your underlying causes. So looking at that blood testing and see what's really going on for you, balancing blood sugar levels, reducing inflammation and nourishing the hormones through food and nutrients, optimizing and supporting gut and liver health, and then creating that supportive lifestyle. So think stress and movement and sleep. They would be my 5 sort of areas to do that, to have that really beautiful holistic treatment for PCOS. And as we do those, over time, it can take time, at least 3 to 6 months. We need to work on with nutrition and lifestyle changes to start seeing changes within the menstrual cycle and symptoms. And you may start seeing some of your symptoms change quite quickly, especially when it comes to things like energy and fatigue, and then a little bit longer for things like the menstrual cycle, and the skin especially can take a little bit of time to clear up. So, and I say that because I don't want women to give up hope that they've tried something and it hasn't worked. It's only been a matter of weeks. We all want results very quickly. I know we do, and I wish it could happen, but just give it some time.
Yeah, I love that. And that's what we say with seed cycling as well. It's like, give it that 3 to 6 months. Unfortunately, it isn't that, it's not that quick fix that we're after, but that the consistency, and then following through over and giving your body time to have those cycles. That's when you start to really see the benefits, and it's so worth it.
Yeah, absolutely. It can really be just those few tweaks and changes that we make, those little adjustments to nutrition and lifestyle that we do over time. It's just, and it doesn't, you don't have to be perfect. It's just about that consistency over time that has a huge impact.
Yeah. I've been asking each guest for a key takeaway. So what would be, that might be difficult because there's so many good ones in there, but what would be your key takeaway?
I think that just knowing that there's no one best diet for PCOS, that nutritional and lifestyle treatment needs to be individualized, holistic, sustainable, and adaptable to your changing needs. So it's not about, as I said, it's not about that one thing that you do, but just looking at your nutrition and lifestyle holistically, that can make all the difference.
Oh, I love it so much. It's been such a pleasure. Thank you, Tris, for joining us.
Thank you so much for having me.
Oh, my pleasure. And we'll chat again soon.
Absolutely.
See
See
ya.
you later.